Hi everybody and welcome to Mom Talks. I'm Kendra. We hope you've been enjoying Mom Talks thus far as we've been talking about there's a first time for everything, but today we are going to be moving on to our winter segment, Baby, It's Cold Outside. And it is cold outside. I don't know if you noticed, but there were a few snowflakes this morning.
I know, it's way too early, I feel like.
And I don't want to put any blame on anyone, but Elsa from Frozen was at the hospital yesterday, so I don't know. I don't think we made her mad or anything, but she brought some snow with her.
Absolutely.
So first topic that we're going to be doing with Baby It's Cold Outside is everyone's favorite winter topic, which is the flu. Yes, the sarcasm was intended. It comes around every year. Every year we hear about just how terrible it can be, especially for your little ones. My daughter had it last year as a 4-month-old, and I tell you, it was the most miserable week probably of my life.
Yes.
So it was just a terrible, nasty, nasty bug. So I'm joined today by Dr. John Cole. He's a Washington University pediatrician with Kids Docs, and we are here at the CSCC, and we are going to have a great talk about everything flu. We want to remind you, send us your questions, send us your concerns. We are here to answer those and maybe shed some light on some myths, some common misconceptions, different kinds of things about the flu, and hopefully keep your family safe and healthy during this flu season. So
sounds great.
I think for starters, just what is the flu? What is it, and what makes it so darn miserable?
Great question, Kendra. So first of all, welcome to all the moms out there, and anybody that has questions, please feel free. We will be happy to answer those questions for you. So what is influenza, or the flu as we call it? So influenza is a family of viruses that cause upper respiratory illness, quite severe in a lot of cases. So you can have everything from fever, headache, sore throat, runny nose, cough, body aches, muscle pain, to headaches, stomach aches. I mean, it's a very talented family of viruses. It's a little more severe than your common cold that a lot of us will see throughout the year because of the severity of the symptoms. So the fever and the body aches in particular can cause people to be very miserable. The other thing that sets influenza apart from some of the other common cold viruses is that it can be quite deadly at times. And so especially in the higher risk populations like older adults, young children under the age of 2 or 3, and then in any patient that has kind of a chronic medical condition like a heart problem, kidney problem, who has an immunocompromised status, the flu can be quite serious. And so it's distinguished from the stomach flu or gastroenteritis. So a lot of people say, I had the flu, and they meant that they've been vomiting or having diarrhea. Influenza, typically more of a seasonal virus family, and again, mostly upper respiratory symptoms.
So it's also very contagious.
Absolutely.
What makes it so contagious, and how can you catch it?
Great question. So the virus is just, like I said, it's very gifted in infecting people, and it's very contagious. So there's estimates from the CDC that someone that's coughing or sneezing can infect somebody up to 6 feet away from them. So it's not something that requires a lot of close contact. It's mostly spread through droplets, like when you cough or sneeze that go into the air, somebody else breathes those in. More or less common, but still possible, is if someone is touching surfaces that have been contaminated by those droplets. So doorknobs, water fountains, chairs, other things like that can also carry the virus. And the virus can survive quite a while on surfaces. So again, that's why it's so easy to spread this.
So Clorox wipes, hands to yourself.
Good hand washing is always important, absolutely.
So let's talk about preventing the flu.
Yes.
And the best form of prevention is what?
So absolutely, besides what we talked about, which is good hand hygiene, trying to stay home from work or from school when you're ill, by far the most important way of preventing the spread of influenza is people getting their flu shots. I can't emphasize enough as a physician how widespread influenza can be and how deadly it can be. And so it's really important for people in the community to protect themselves and their families and neighbors by getting the flu shot.
So who can get the flu shot?
So anybody above the age of 6 months old can get a flu shot. So the problem with the pediatrics that I deal with is that babies under that age cannot get a shot, and therefore they rely on the herd immunity from their families and from the rest of the community who hopefully has gotten their shots in order to get the protection that they need to keep them from getting the flu. Anybody above the age of 6 months old can get it. Now, again, depending on the type of flu vaccine you're getting, there are age requirements for that. So, for instance, for the shot, 6 months to 3 months old, they typically will get 1 dose. Anything above 3 years old, they will get the adult dose. For the flu mist, which many of you may have heard has made a comeback this year, that's for children 2 years old up to 49 years of age for adults. Once you're 50 and above, they do recommend the flu shot.
Now, I've heard a couple of different things about the mist. Is it as effective as a shot? What makes it different?
Great question. So the difference between the flu mist and the flu shots, the flu mist is a live attenuated virus. So what does that mean? What it means is that the flu viruses that go into making up the vaccine are still alive, but they've been turned off, so they can't cause infection. That's different than the viruses in the flu shots, which have been killed. So they are no longer alive, they are no longer active, and as we'll probably talk about in a few minutes, they cannot cause disease. So what happens is that the mist is a nasal application, so you spray the mist up into the nose. The viruses, by being alive, they're still able to invade the cells in the nose, and then your immune system responds and causes a reaction that will give you immunity, hopefully. The killed virus goes into the bloodstream. Again, the immune system will learn from it, will attack it, if you will, and then that will help to generate an immune response.
Okay, did I see we have a question?
Yeah, one of our viewers is asking if their child will experience flu-like symptoms after receiving the vaccination.
Common misconception.
Yes, absolutely. That's a great question. I hear that all the time in my office. So what I like to tell people is, with any vaccine, it is not unusual because you're stimulating your immune system to respond and generate immunity against that particular illness. Common symptoms that you can see would be things like some fever, feeling a little more tired or fatigued than normal. Some people will complain of some tenderness at the site of the injection. But honestly, the flu shot, because the viruses are dead, it does not cause influenza. And I cannot emphasize that enough. So I hear many times from parents or from grandparents, well, I haven't had the flu shot in years because every time I get it, I get the flu. You may have a response to the immunization, but you're not getting the actual influenza unless you just happen to be unlucky and next to somebody or were contaminated by somebody.
Next to the wrong person in the clinic.
because again, the shot does not cause influenza. It prevents influenza.
Okay, and so let's talk a little bit more about the shot.
Sure.
What else does it help protect you against? I remember when I was in college, H1N1 swine flu. That was a big thing.
Yes.
Am I still protected from that?
Great question. So every year the flu shot is generated. They look at the previous year and they look to see what are the most common circulating flu viruses that are out there. And then they try to build the vaccine in order to protect against those strains. The flu shot, you have a trivalent or 3-strain vaccine, and then you have a quadrivalent or 4-strain. And what they do, each of the flu shots has 2 of the influenza A strains, and we can describe that a little bit more. And then they either have 1 or 2 of the influenza B strains. So what do I mean by flu A and flu B? Every flu virus has certain proteins on its viral coat that cause it to allow us to identify it. So when you hear the name H1N1 or H3N2, those are specific strains of influenza A. And then you may hear names like Brisbane strain or other things. Those are the flu names for flu B. So what we do is we look from the data and surveillance that the public health departments around the world have. What they will look at is they'll say, okay, what strains are the most common? And then we'll take the 2 A strains and 1 or 2 of the B strains and we generate the flu shot. If we're fortunate enough that we are still seeing those strains as the major circulating strains, then we usually will have a good match, and that's when the flu vaccine is more effective in a given year. If we're unlucky, which happens once every so often, every probably 7 to 10 years, you will get a mismatch of the strains of what's in the vaccine versus what's circulating, and then the flu vaccine may not be as effective.
I think I remember a little bit of that last year where people would say, I got my shot and I still got sick. You know, we heard about that a little bit in the news, but last year was such a terrible year.
Last year was a horrible year, and so I did some research from the CDC, just looking at what their estimates were for the past flu season. For the 2017 and 2018 flu season, we had almost 50 million cases of influenza in this country. So that's about a sixth to a seventh of the population of this country. When you look at pediatrics in particular, so people under the age of 18, 11.5 million cases of influenza. That led to over 48,000 estimated hospitalizations, and that led to estimated 600 or more deaths in the pediatric population alone. We confirmed 183 of those in laboratory analysis, but when you do the estimation models, they think that it was a much higher number. This year in particular, the past year was a very rough year for influenza. In the last decade, I think they estimated we lost almost 80,000 people of all ages to flu. And this is not just people who are at higher risk, but this included some very healthy pediatric patients who had no pre-existing conditions, were perfectly fine, got the influenza, and within a few days were gone.
Wow, that's such a scary statistic.
Very scary.
We're going to keep talking about some different things with the flu, but we just want to remind you, if you still got questions about the shot or about the mist or about anything else related to either of those things, please feel free. Go ahead and type them in. We will definitely get back to you on those, and we can keep. We're just going to keep on going though. I think last year when I remember my daughter had the flu, my first question was, well, is this the flu or is it just a really bad cold? So how does a parent differentiate between the two?
That's a great question. So there's obviously at any season there can be a lot of different circulating viruses. So right now we're seeing mostly this enterovirus or rhinovirus that's been causing a lot of people's colds in the St. Louis region. We're seeing adenovirus, coronavirus, RSV is starting to come up.
Yeah.
So, and the thing that we forget is that each of these viruses causes their own infection. So just because you get infected with one of those earlier in the season doesn't guarantee that you can't get infected with another. So I typically will tell my parents that it's not unusual for a healthy child to have 6 to 8 infections a season. So when you think about the winter season being 3 to 4 months, we're talking once or twice a month. So when people feel like, oh, my kid's constantly sick, especially if they're in school or daycare or preschool, that's why. It's because there's just so many different circulating viruses. What separates influenza is the propensity that it has to make things worse. So typically these are kids with higher fever, worse cold symptoms, just really lethargic or listless, not feeling well at all, complaining of their body aching. But it doesn't have to be that way. So that's what's frustrating about influenza, is that it sometimes can be milder, especially in patients who have been immunized. So what I tell people is, a lot of it just depends on how active is the flu virus circulating in your community at that time. What is the level of suspicion that you and your pediatrician should have about checking for influenza? And then what's really important is, especially if you're thinking that it could be flu, the earlier that you get diagnosed, that gives you a greater flexibility in receiving some of the treatments that are available for influenza. But once you get past 2 or 3 days of symptoms, even if you have the flu, your doctor is less able to treat than they would have been in that first 24 to 48 hours.
So we have another question.
So one of our viewers is wanting to know, if they got the flu last year, does it make them more susceptible to getting the flu again this year?
Great question, great question. So again, because there's so many different circulating strains of influenza, it's hard to know what strain you had last year and whether it's going to be the same strain that's circulating this year. So it's still very possible that you could get influenza in multiple successive years because of different strains, or maybe you just didn't generate as strong an immune response if it happened to be the same one. That's part of the frustration of designing the flu vaccine, is because sometimes we nail it and we get it right and then we're able to protect a great number of people, and sometimes it's not a great match and we end up still seeing people catching the flu even if they got their shots. But by far, the majority of people who get influenza in a given season are people who were unimmunized. And that is because of the fact that they just don't have the immunity build up. And because there's so many different viruses, immunity to one doesn't necessarily guarantee immunity against another. And that's what's challenging.
That's not what I wanted to hear. We have another question.
So another one of our viewers wants to know how long flu symptoms generally last.
Great question. So most people with flu symptoms untreated can go 5 to 7 days with symptoms. Now, some people are lucky and it may be a milder case and maybe it's only 2 or 3 days. And then unfortunately there are people who can get more sick and they can develop the complications of flu. And the complications vary widely. So the most common complication we can see is pneumonia. That can be caused, ear infections, sinus infections. So again, if you develop a complication of flu, then unfortunately your course may go longer. The really severe complications that we worry about as pediatricians in particular are when the flu virus infects and causes problems with the brain or the heart. So the flu virus can attack those, and it can cause a condition called myocarditis, which is inflammation of the heart muscle. It can also cause encephalitis, which is inflammation of the brain. And these are both things that can be very, very problematic and even deadly to the patients if they're affected by that.
One thing I think, as a parent, I know when I'm not so sure, is this the flu, is this the cold, oh my God, we need to go to the pediatrician,
Right.
We need to make that appointment. When do you suggest, or do you suggest just getting in and seeing your pediatrician?
Great question. So what I tell people is a lot of it depends on what you're looking for. So if flu activity in your region is high and you are suspicious of influenza, I say get in earlier because again, within that first 24 to 48 hours, your pediatrician, if they're able to diagnose flu, then they are able to offer treatment. Once you're outside that first 48-hour window, it becomes less likely that the treatment's going to be beneficial. Now, if you're a high-risk patient like an asthma patient or a heart patient or someone else, they may still offer those treatments, but unfortunately for a lot of people, when they come in on day 3 or day 4, it's too late and the medicine is probably not going to be helpful.
Let's talk real quick about treatments.
Sure.
What can a doctor give you or do if you come in during that
Sure.
first couple of days?
Sure. So obviously, as our moms and grandmas all told us when we were growing up, the most important thing is plenty of rest, drink lots of fluids. You can do ibuprofen or Tylenol for the fever. So those are very helpful things in general. What your pediatrician or doctor can do within the first 24 to 48 hours are medications like Tamiflu, which many of you have probably heard of.
Oh, yeah.
And then for older children, there is a medicine called Relenza, which is kind of an inhaled medication as well. Those have very good activity against flu, and the earlier you start them, the better that they act. And what they can do is, on average, they can knock down the severity of the symptoms as well as the longevity of the symptoms by a day or two. So for some people, especially when you're trying to get back to work or get back to school quickly, those few days can make a big difference. The other thing is that typically with the flu antiviral medication that we can prescribe, the earlier we start it, the less likely, it's never zero, but the less likely the chance of developing complications later on. So that's why I think it's important to try to seek out attention if you're really concerned about flu. Yes?
So one of our viewers has a specific case question.
Go for it.
Is there a type of flu going around that causes vomiting and diarrhea but no fever? And that typically lasts 3 to 5 days?
Yes. So again, influenza, like I said, is very gifted and it can do things like vomiting and diarrhea, and you don't always have fever, you don't always have upper respiratory symptoms. So again, a lot of it depends on how prevalent the flu virus is in your community. Right now, fortunately for us in the St. Louis region, we're not seeing a large amount of flu activity at this point, at least from the reports I've been getting from the local hospitals. However, we anticipate that as the months come, that will probably change. There are other viruses, like I said, gastroenteroviruses, like rotavirus and things that can also cause vomiting and diarrhea. So again, if you have any suspicion of whether it could be influenza, whether it could be another virus, I think it's a great idea to call your pediatrician or doctor as soon as possible, see if they can get you in, and then they can do testing or they can listen to the symptoms and do their examination, and they can tell you what they suspect would be the most likely cause of those symptoms.
I will tell you, just as a personal note, my daughter and I had some stomach flu a couple weeks ago. So if you're going through that, my sincere apologies. Please feel better.
Absolutely.
I just also want to remind you, if you have any questions about symptoms or about differentiating the flu from other things, please go ahead, write them in. We will definitely take them. We are here to answer all of those questions. I know it's hard. Google is not always a great forum for finding medical advice. So if you're interested in finding out and in asking a doctor directly, go ahead, write us in. I do want to get back to Tamiflu because I remember my daughter had Tamiflu last year and just didn't like it. She spat it up every time we gave it to her.
I don't blame her. So
yeah, it's nasty, but
unfortunately in pediatrics, a lot of the medicines that we use that are very effective are not the greatest tasting. I keep telling my patients, my kids, I said, if you can invent medicine that tastes good and that it will be effective, you'll be rich. But Tamiflu is one of the most common side effects of Tamiflu in children is that it will make them feel nauseated, stomach ache, and they will vomit. So what I try to do to alleviate that is I either will have them give it with a little bit of food or something that they like, like yogurt or something, just something that will help it to stay down a little bit better. The other nice thing is the Tamiflu capsules, they can be opened and sprinkled on food. For people that don't necessarily like the liquid taste, you can try that, and for some of our patients that has been effective. But yeah, none of these medicines taste great, and that's always a big challenge in pediatrics is being able to get our children to take the medicine. So absolutely, the pediatrician can work with you on strategies on how to do that.
And I'm sure all of you parents of little toddlers and babies, it is not easy to reason with them on taking the medicine.
It is not. That's what's so challenging. That's what we love about pediatrics is kids are so genuine and they just tell you what they think. And when it comes to medication, they definitely have strong opinions. And as parents, we struggle to get them in. But if we're able to be successful, it can be very helpful.
Now I want to move on. We were talking a little bit about how the flu, it's annoying, but it also can be deadly.
Yes.
It also can be a very, very dangerous situation.
Yes.
So at what point would you recommend, say it's, 10 at night, my kid has a fever, and I'm thinking it's the flu. At what point would you recommend getting into the after-hours clinic, maybe the ER, versus waiting into the morning to get in with my pediatrician?
Great question. I think as a parent myself and as a doctor, my worst fear is waiting and waiting, thinking things are going to get better, and then the morning comes and something bad has happened. So what I tell all of my patients and families is, at least in my belief, and I believe most pediatricians would agree with this, we are here to serve you. And so if you have any concern, no one will blame you for seeking care early. And even if we're able to reassure you that everything's okay, at least we have established a baseline of how your child looks, and we can discuss, okay, if this happens or this happens, call me back immediately. I think the biggest challenge that people have is they just don't want to either bother the doctor, or maybe life is just so busy and they've got things going on. An example of this recently that was just tragic, and if I'm remembering the story correctly,
I know which one you're talking about.
Is the family in Florida who had a very healthy young child, and in fact both parents are physicians, and they were planning to get the child's flu shot at their siblings' well visit that was coming up. It was like a week away, and the child contracted influenza, reportedly was perfectly healthy, had no underlying conditions that I was aware of. And the parents lost this child, and it was just devastating. And they were like, why did we wait on the flu shot? And honestly, they did nothing wrong. It was just, unfortunately, we forget sometimes that even though we live in a very civilized country and we have all these great technological and scientific advances, we still live in a natural world that we can't control. And sometimes illnesses can take us before doctors can do anything about it. And I think that maybe we doctors should do a better job of explaining this to our patients, is that yes, we spend a lot of years and we really try to have as much knowledge and we really try to give you the best medical advice we can to help you live healthy lives, but we are not perfect and we do not have perfect tools, and sometimes things just can happen so quickly, and no one can predict this. All we know is that every year it happens. And so that's why it is so critical for people to, if they have any question about their child's health, call your doctor. And if you feel like that for whatever reason you can't get in and you still have concerns, go to the urgent care, go to the ER. I would much rather someone go and it end up being a quote-unquote waste of their time than to not do something and then to be dealing with a tragedy like this.
So let's talk about a couple of the danger signs.
Yes.
When would you, as a parent, start thinking about getting in the car?
Great question. So for me, a couple of things that I look at. First of all, is the child having a high fever? And so I'm talking anything 102, 103 or higher, I definitely should be calling my doctor's office. But the number itself is not the only important thing. You know your child well, more than anybody else does. How are they acting? How do they look to you? So if I have a child that's having a fever, but they're alert, they're drinking, they're active, they're breathing comfortably, I tend to be a little bit more comforted by that. But if I have a child that's really listless or lethargic, they're not responding like they normally do, they can't seem to keep themselves awake, they're really working harder to breathe and not feeling as comfortable, that's the time, you know, that you want to definitely be seeking medical attention, because the problem is sometimes these cases can escalate quickly. And so having the doctor on board, being able to evaluate, being able to initiate appropriate treatment if you're within a certain time period, those are all critical factors. So those would be the most common things that I would look at. And then again, I tell parents all the time, I know you're not all medical professionals, I know that the reason you hire people like me is to be able to ask questions like that, but I tell my parents, trust your gut. Even if your gut ends up not being right, and that's okay, trust your gut. So if your gut tells you there's something off about my child and I don't like what I'm seeing, call your doctor. I cannot stress that enough. Call your doctor, and if they're able to see you or reassure you through a phone conversation, just making that connection is so critical to peace of mind for parents. And again, you know, what none of us want is a tragedy like I described. And so to me, I would rather have a person come in every day if they have to be reassured than to sit there and worry and panic and then have their worst fears realized.
You know, they talk about the intuition, parents' intuition. I remember with my daughter, picking her up in the middle of the night, and I'm like, you are burning up. Her dad walked in the room, put his hand on her forehead and said, let's go. And
absolutely.
I'm so glad we did.
Absolutely.
Just, I mean,
the worst thing that happens is you spend some money that maybe you didn't have to. You take up some time in the wee hours that you'd rather be sleeping.
It was a very long night.
but the honest truth is, I feel like most parents, when they listen to their gut, when they consult a knowledgeable professional like their pediatrician or family doctor, that is what prevents most tragedies. Again, nothing's perfect in the world, and even sometimes when you follow up with the doctor's done everything right, they've made the appropriate recommendations and treatments. Sometimes things just don't go the way we want them to, but we can certainly diminish the likelihood of that by getting people to connect with their physicians sooner. And again, as flu activity starts to pick up more, because flu can look like so many things, if you have a suspicion at all, call earlier, and that gives your doctor more of a window of opportunity to help than waiting until things get really bad.
Because unfortunately we know, and you were talking a little bit about this earlier, about how it can start as the flu and untreated can move to pneumonia or other kinds of infections and or even...
Absolutely. And while we're talking about pediatrics, the plug I want to put in too for the reason why you should get a flu vaccine for your children is this is really an opportunity for your children to help the community, and particularly people that they love very much, like their grandparents, because the vast majority of people in the high-risk category are people 60 and older. And so they are the ones most likely to suffer complications from influenza. So we know how much grandparents and grandchildren love being together, and that's the way it should be. But unfortunately, nature knows that that's a great combination for spreading flu, because kids often are coughing or sneezing without using their sleeve, or they're not washing their hands maybe as well as we would like them to. And because our grandparents and elderly people are more susceptible to the complications of flu, this is where not only in protecting your own child, but letting them, through their vaccination, help protect the community at large and people that they care very deeply for, I think is really important to remember as well. So,
just a reminder, we are continuing to take questions as we start wrapping everything up. I did want to kind of talk to you about yearly, every year it seems like the flu season's a little different.
Yes.
I think everyone remembers how bad it was last year.
Yes.
Does the CDC have any kind of recommendations or any thoughts about what this next season's going to bring?
Great question. So right now, knock on wood, we're hoping that this is going to be a milder year than last year. And the reason why we think that is we typically follow the southern hemisphere in terms of the severity of flu season. So last year, Australia reported a very severe flu season prior to our own severe season. This year, the flu activity has been milder. I don't want us to mistake that and say, oh, I can relax, I don't have to do anything. No, we still have to be very vigilant, because I was looking back the last 10 years of data from the CDC, even in the most calm year for influenza, which I think was the 2011-2012 season, if I'm remembering correctly, they still estimated we lost about 12,000 people in the country. Now, 12,000 compared to 80,000 is a big difference, but to me, any loss is one too many. And so, especially with something that we can at least do our best to prevent, again, nothing in medicine is perfect, and anybody that tells you that, they're selling something. But what happens is that if we can prevent this, if we can do our part as a community to try to halt the spread, then that gives everybody a better shot at staying healthy. And so the reason I'm so pro flu vaccine is because we even if we have a mild season, that doesn't mean that there still won't be some severe complications. That doesn't mean there still won't be some unnecessary deaths that occur. And if we can help prevent even one of those, to me, it's worth it. And so that's why it's so important. Regardless of the severity of the season, we just take each season as if it could be severe. We take every flu illness as if it could be serious, and we try our best to prevent that in the first place by getting our vaccination.
So absolutely, we want you to get your flu shot as soon as possible if you haven't already. Where can folks go to get their shots?
Great question. One nice thing about flu vaccination is that it's widely available, and that's been through a partnership of physicians' offices, schools, workplaces, even local pharmacies and different systems like the library system where you can go and get a community flu vaccine. So to me, whether it's in your doctor's office, whether it's somewhere else, the big encouragement is just get the flu shot. Wherever you get it, obviously as a pediatrician, I like to know that my patients have gotten it. So if your children do get it somewhere else, make sure that your doctor has a copy of that information so that they can include it in their shot record. But it's really critical, wherever you can get it. And I know that pediatrician offices like ours stand ready to assist families because we want to make sure that they have that available.
We're going to do one last check for questions. Going once, going twice. Okay, well, Dr. John Cole, thank you so much
My
for
pleasure.
joining us.
Thank you.
So this is going to wrap up Mom Talks for this week. You're invited to join us next week. I'm so excited about next week's topic. So we're going to be talking about holiday eating, which doesn't love to eat around this time of year. It's going to be our last episode before the Thanksgiving break. So we're going to be talking to one of our St. Louis Children's Hospital dietitians, also one of our very talented chefs. We're going to be talking about some good foods to eat around the holidays, maybe the ones that are kind of the special treat, that maybe you have once, twice during the holiday season. We're also going to be doing some really fun, kid-friendly holiday recipes, so it is going to be a lot of fun. But until then, I'm Kendra. Thank you for joining us.
Thank you.